Hi, sorry, and thank you for the slight change of plan. My name is Anya Topiwala. I'm a consultant in the JR, the Psychiatrical Medicine team, and I do research in the Department of Psychiatry, particularly focused on the effect of drinking on brain health. Can you hear me? Yeah. Is that right? Okay, fine. So I'm going to talk a little bit, try and give you an overview of how alcohol affects the brain in terms of heavy drinking plus moderate drinking, and I'm going to talk a little bit about some of the research we've done recently, and then I was asked for some tips for GPs, which hopefully I'll do. And I'm very happy to take questions at any point. If you don't understand something, just put your hand up. Okay. So you're all probably familiar directly, or at least observed, the effects of acute intoxication from alcohol. So we get behavioural disinhibition, disrupted socio-emotional processing, psychomotor impairment, and in terms of brain function, particularly prefrontal and temporal lobe impairments. But what I'm really interested in, if you do this and drink over long periods of time, what's the impact on the brain? And classically, I learned at medical school, perhaps you did as well, about one of the most dangerous syndromes, Wernicke's encephalopathy, and this is the classical triad here of ophthalmoplegia, confusion, and ataxia, although many people don't get all three. And the key problem here is a thiamine deficiency, and it's got almost 20% mortality untreated, and another concern is progression to Korsakoff syndrome, usually irreversible damage, again through thiamine deficiency. And the key cognitive deficits here are prominent anterograde amnesia, so failure of long-term storage, and also prefrontal deficits, so problems planning or completing complex tasks. But I think this thiamine deficiency is only one part of the alcohol story. Probably alcohol is a direct neurotoxin. There's other mechanisms of harm too, head injury, etc. And we know now that alcohol affects the brain in a widespread manner. So memory body atrophy is almost universal, but the frontal lobes are particularly vulnerable, especially white matter, and also the hippocampus, classically we think of affected early in Alzheimer's disease, but is also very susceptible in alcohol excess. So it's been known that heavy alcohol over long periods of time causes widespread brain damage and increases risk of dementia. And this was a big study that came out last year from France, where they looked at electronic health records from secondary care and psychiatric care, and found that if you had a coded diagnosis of an alcohol use disorder, so heavy drinking, it was the greatest risk factor for dementia out of the ones listed here. I don't know if I've got a pointer, anyway. So you can see here, alcohol kind of dwarfs any other risk factor, and notably, if you look in detail, there's a big Lancet Commission for Dementia Prevention that came out last year. You may have been aware of it, and it looked at most of these risk factors, but alcohol was the one thing that was omitted, and probably it's one of the most important. The other interesting thing I thought from this paper, and if you can see at the back, but you're looking at number of people affected by dementia here, according to age at diagnosis. On the top, just coming off the slide, this is all ages, and this is early onset. And what's striking, as you can see, the numbers in red with a diagnosis of alcohol use disorder. So I think, particularly in early onset dementia, we really need to be thinking about alcohol excess as an etiological factor. So alcoholic dementia is a kind of umbrella term. There's no internationally recognised classification of alcoholic dementia, but probably there's a primary form, so directly a result of direct neurotoxicity, secondary mechanism via thiamine, maybe other mechanisms. In terms of prevalence, I think we really don't have a clue. This is a bit of a stab in the dark, these numbers. I suspect we are underestimating at the moment. Often an earlier onset than Alzheimer's or vascular dementia. And in terms of how much you need to drink to give yourself a dementia, we really don't know. There's only one study that's almost 20 years old now, Oslin, that suggested perhaps for women 28 units a week for 5 years, or for men 35 units a week, so not terribly much. But as I say, there's a bit of an evidence gap there, and there's probably a lot of heterogeneity in terms of how vulnerable people are. But all's not lost. I think the important message here, and also for us as clinicians, is there can be some recovery on abstinence, and that's in terms of cognition, but also brain structure. So this is one such study which did serial scans 7 days, 1 month, and 7.5 months after abstinence, and there was some improvement in grey and white matter, and you find the same if you look at cognitive testing, although there is long-term deficits that never recover. But there is hope for people, even if they have damaged and got cognitive impairment, that they could improve things if they stop drinking. So I think the case for heavy drinking over long periods of time is pretty open and shut. We don't know all the details, but it definitely is harmful. In terms of moderate drinking, this is really still a kind of conflicted area. There's been a story for a long time that your glass of red wine at dinner is protective against dementia, and this is one of the earlier studies in the New England Journal, which followed up women in the States over a period of time and showed that not just at baseline, but after 2 years, those drinking small amounts of alcohol were protected against cognitive impairment. And there's lots of other studies that have shown this. And this has led to this suggestion that the relationship between alcohol and brain health is J-shaped, i.e. Those who don't drink at all are at higher risk of problems than people that drink moderately, whereas those that drink very heavily are at higher risk. And the same curve has been cited for relationship between alcohol and heart disease and stroke as well. But I think there's a couple of problems and concerns about the way some of these studies were done, and really the issue is about confounding. So if you look at the kind of people who drink moderately, they tend to be better educated, higher income, more complex jobs. Those kind of people are healthier, they do healthier things, they exercise more, they're likely to do better at memory tests at baseline, and therefore less likely to get diagnosis of dementia. And this really hasn't been adequately addressed in the studies that we've got to date. And the other thing is that if moderate drinking is protective against dementia, then surely the brain findings should go along with that, and that's really not been the case. The imaging studies have been really conflicted in their results. So we reviewed this last year, the evidence, and as you can see for the left, so the middle column here, heavy drinking, pretty convincing, widespread brain deficits or brain damage, and increased risk of dementia, whereas for moderate intake, the whole evidence base is very conflicted. So we looked at this in Oxford by studying a group of people in a very special study called the Whiteman 2 study, and this was a group of civil servants recruited in the 1980s, and they've been followed up for more than 30 years now, and they're very dedicated. They've had lots and lots of testing over the years, and including being asked about their alcohol intake and other behaviours, and had memory tests. And we got 800 of these people and invited them to Oxford for more detailed memory testing and brain scanning over the last 5 years. And this group, you have to understand the context. So these are, by and large, middle-class, white, well-educated, more men than women, who do all the right sort of things that you should do when you're retired, like volunteer work, crosswords, taking daily walks, etc. But we did notice that they did enjoy a drink or two as well. So we thought this would be a really nice group to study. So this just shows you kind of men versus women. The fewer women here, because obviously in 1980 civil service, less women in the post, and how much they were drinking. And I should mention that none of these people were alcohol dependent as defined using the CAGE screening. And if you compared safe to unsafe drinkers according to our national guidelines, the only significant differences between the groups were that the unsafe drinkers had a higher IQ, and there were more smokers in that group as well. And I think this really speaks to the confounding issue, and I'll come back to that. So we looked at these people's brain scans, and we looked across the whole brain. We kind of effectively chopped up the brain into 1 millimetre cubed volumes, and in each of these volumes looked, was there an association between how much they drank over the 30 years and how much grey matter there was in their brain. And you're looking here at a statistical image where the orange and red splodges are where we found a significant association with their alcohol intake. So the more people drank, there's less grey matter in this region, and this is basically bang on the hippocampi. Quite shocking for us. So no protective effect, adverse association. And we confirm this with a few other different methods. We don't need to sort of go into the details here. We basically, there's a scale that you can visually check the hippocampal volumes and how shrunken they are, and we replicated the same result. So here you're looking at the alcohol intake in terms of units per week on the left-hand side, and the odds of having hippocampal atrophy, so shrunken hippocampi, and hopefully you can appreciate there's a dose-dependent relationship, so the more people drank, the smaller their hippocampi. Just 14 units a week or more increased your risk, so really, we thought quite small amounts.
Does it reverse if they stop?
Don't know, haven't got that data. Difficult to do, yeah. We then looked at a different type of brain scan called diffusion tensor imaging, where you're measuring water diffusion across the brain in different directions, and it gives you a measure of how good the white matter tracts are, so how well insulated. And again, disappointingly, we found the more people drank, the less good quality their white matter was. And I should mention that we've accounted for all sorts of other factors that we know affect grey matter and white matter here, so your age, your sex, your vascular risk, whether you smoke or not, your exercise, whether you're depressed, etc. So these results stood despite adjustment for all those different factors. I mentioned that these people had memory testing over the 30 years, and we then looked at did the amount they drank affect how their memory changed over the 30-year period. And on one particular test, so lexical fluency, and that is when you ask somebody in a minute to name as many words as they can beginning with a letter, so frontal lobe function, quite a tough test. Again, the more people drank, the quicker they declined over that 30-year period, and that went for anyone drinking 7 units a week or more, so not much, within what we consider as safe guidelines. Okay. And we basically tried to put that all together using statistical modelling, and found that so the more you drank over the 30-year period, the smaller your hippocampus, the worse your white matter, and the faster your memory declined. And it was an effect similar, not as great in magnitude, but similar to aging itself. So I think the strengths of this kind of research were the duration. Having data over 30 years is quite rare and takes a special kind of group of people. And the fact that they were asked at the time how much they drank, rather than trying to remember what they drank 20 years ago. The size of the sample was quite large for this kind of study at the time, and the depth of information we had on people was quite unique. Obviously, it's observational study. People were asked and had to report how much they were drinking. There may be the fact that they were being watched, and they knew they were being watched made them live healthier lifestyles and drink less than the rest of us would. There's always a question here about, does the alcohol cause the memory problems, or do people with memory problems start changing their alcohol? But again, the fact that it was prospective and over such a long period of time, I think reduces some risk to some degree. And the generalisability of these findings, so as I've mentioned, this was a kind of unique group of people and doesn't necessarily apply to the rest of the country or other countries. So hopefully you can just about pick out the colours here, but it's showing safe alcohol guidelines for different countries. So we're now very conservative internationally compared to some other countries, but even within these conservative guidelines we had effects at 7 units or above. But I think we got quite a lot of excitement from the States and Australia when the results came out, I think, because their guidelines were so much more generous than ours. I think one of the points for clinicians is that we thought we'd done a really nice job with this study, and then earlier this year, on the same group of people, larger, but ones that we've selected from, they came up with, or would look on the face of it to be opposite results. So abstainers having higher risk than moderate drinkers. And I think this is part of the problem for the public and trying to communicate what to do for us clinicians, because every week they're reading a different story about what alcohol does. When you looked into this, when I looked into this study, they split it down by age, and I'm sorry, you probably won't be able to see, but basically the protective effect of moderate drinking over abstinence was really only seen at 70 years old, and this, I think, is very suspicious of reverse confounding. So people that are becoming demented start stopping drinking, rather than perhaps abstinence causing you higher risk of dementia. And the abstaining group was slightly older, so they had higher cardiovascular risk, etc. So I think you have to really look carefully at a lot of these studies, and that's really hard to do for the general public. I'm not sure how close or when we'll get a definitive answer. Obviously, this is the classical kind of hierarchy of evidence that we think of in medicine, with RCTs near at the top. And I always thought, how on earth are you going to do an RCT of drinking, right? But then there was this MASH trial that you may not have heard of in the States that was hugely expensive, and they were going to randomise people to moderately drink or not over a number of years and look at their cardiovascular outcomes. It was only powered to detect any beneficial effects, and then the New York Times uncovered this huge stink. It's really interesting. If you're interested, Google it and you can see the whole story. But basically, the researchers were going to the alcohol industry and courting them for money, and they had donated $100 million to this and said, oh, we'll really show you a protective effect of moderate drinking. So it's been now shut down, so I'm not sure we're going to get the RCT after all. And there are other techniques now, people are looking at using people's genetics, maybe a different way of trying to answer this question. But there have been quite small studies to date, and they've really not shown any protective or harmful association as yet, but this is kind of early in the day, I think. So I was asked to provide some tips for primary care, and I'm not sure I'm in the right position to do so because you're in such a tough position, 7-minute appointments we hear. But on the other hand, you see people, over long periods of time, little and often, and so that really represents an opportunity that, for me, working in general hospital, I get to see somebody once, maybe 3 times, hardly any bites of the cherry. So in a way, you're in an optimal position to detect and do something about this. I think if I had to pick out some things, I'd say be vigilant for heavy drinking. The latest data shows it's not who we necessarily suspect. It's your middle-aged, men often who are earning quite well with good jobs. They're the ones that are drinking very frequently compared to anyone else. So don't miss that. I think it's always worth giving thiamine in heavy drinkers, and there's, in terms of at least you're minimising harm from that one pathway. I think it's difficult what message to give. I generally say there's no clear benefit to moderate drinking, and try to dispel that myth as I believe it. And there may well be harm at much lower levels than we previously thought. So that's my general approach with patients. I think in people presenting young with memory problems, it's definitely worth having alcohol in your brain, looking at that French study. And also in heavy drinkers, people that are drinking heavily, monitoring their memory and detecting changes early. And I think I'd say don't give up hope, even in the heavy drinkers who've got memory problems already. There is at least some reversibility, I think, so it's always worth trying to cut down or stop, even sort of later in the day.
Do you generally recommend when somebody's got evidence of any alcohol, they go on violence, they stick on it?
Yeah, I would.
So just
Yeah. And in hospital, when people come in with any confusion and any suspected Wernicke's, I just stick them on high dose as long as I can. Because I think it's always worth getting a decent trial.
Sorry, I think I missed that. At what point do you start buying?
Any heavy drinker, to be honest. Personally, you mean oral thiamine?
How do you define that? On the basis of what you just told us.
Yeah, I think that you're in a bit of an evidence gap. So definitely somebody with alcohol use disorder or dependence, certainly. I mean, I don't know how strict your guidelines are, but I would, if anyone's much in excess of the safe guidelines, I'd be tempted to start it. Yeah.
Yes, so thank you. We have time for a couple of questions. Yes, please.
Are there any trials or studies in progress that are likely to get more right on this in the future 5 years?
What drinking and
Yeah, the relationship.
so no randomised control trials that I know of. Obviously, with kind of big data, the move now is looking at bigger and bigger samples like the UK biobank you may have heard of, so I think we'll start looking at that and maybe using some of these genetic approaches.
Those kind of longitudinal social studies on things like understanding society that are done in 5 years, household surveys.
Yeah, I mean, there's a lot of epidemiological studies that follow people up for long periods of time, but the problem is that they have some of these issues. So I don't think the answer will come from those over and over again, because if they've got biases, we're just repeating the same biases. I think we need to start looking with different methods, different angles at the same problem. If they all give the same answer, that will be the most convincing evidence we can get.
Sorry, could you remind me what the hippocampus does? I can't remember.
Yeah, so it's basically memory, yeah, and spatial navigation. But it's one of the first affected. Sorry. You should have asked me that 20 minutes ago. It's one of the first affected regions in Alzheimer's classic.
Okay. Thank you very much.
Thank you for switching.